everyone, and welcome back to my channel. So before we get into the video, I want to just welcome all the new subscribers and thank you for watching my videos, liking them, and all of that. So you've probably already seen by the title down below, today we're going to talk about CVCs, or otherwise known as central venous catheters. So CVCs are basically devices that are inserted in patients to administer IV fluids, antibiotics, blood transfusion, or sometimes chemotherapy. And oftentimes CVCs are inserted if a patient has very poor peripheral access and will require a long-term treatment of, say, antibiotics or chemotherapy. You may come across it in your practice depending on where you're working. At least once you come across it. If you're a student nurse, this is good information to know. You may not be allowed to actually use them, but you will eventually have to use them as a staff nurse. So this is also educational for you. Medical wards, you will get a few CVCs here and there, but it's mostly in, I'd say, ICU that you will have to deal with central line CVCs on a more regular basis. So what are the different types of CVCs? So you've got central lines, they're usually in the neck. You've got PICC lines, usually in the arm. Porticats and Hickman lines as well are usually around. They look different. A lot of times there's lumens hanging out but secured. So for today we are going to talk about one particular type of CVC, and that is a PICC line. What is a PICC line? A PICC line is a peripherally inserted central catheter. They are very easy to use. They last for about a year. You can have them for about a year if you're taking good care of them and avoiding any complications. And they're usually in the arm, and basically the catheter goes all the way into the arm and into the SVC, into the heart. So we're going to go into the care and management of PICC lines. So the first thing you want to think about when you are managing and caring for PICC lines is how to use them. So if you're going to use a PICC line for, say, antibiotics or IV fluids, you want to make sure that you use ANTT, that is aseptic non-touch technique, and you want to use the push-pause technique when you are flushing. So you want to flush the PICC line before and after administering the medication or IV fluids or any other product that you administer into the line. So what is the push-pause technique? So say, for example, you're administering 10 ml syringe of normal saline, you're flushing the line with. You want to make sure you clean the lumen that you're going to administer it in. Clean the lumen with an alcohol wipe. After that, connect the syringe. So it's normally advisable that it's the lower lock syringe that you're connecting. And then when you're doing the push-pause technique, so I'd say 1 to 2 mils, push, pause, push, pause, push, pause, push, pause, push, pause. And it needs to be a good push and pause, good push and pause. And why that is, what that actually does is that it creates turbulence at the end of the line. And this will help prevent any future clots that may potentially develop in the catheter. So it's the push-pause technique that is very essential, and the aseptic non-touch technique when you are flushing the PICC line. Next thing is dressing management. So if you are going to do your dressing for the PICC line, it might be daunting if it's the first time you're doing it, but it's nothing to worry about. You just want to make sure you have all your equipment. You want to make sure you have your dressing pack. You want to make sure you have your sterile water. You want to make sure you have your dressing. A really good dressing, I would say, is the Tegaderm CHG. It's really good. It's a clear dressing and it allows you to actually see the insertion site. Then you want the grip lock, and that is going to keep your lumens together. So you want to basically gather all your equipment, explain to your patient what you're going to do. It's very important that we provide education for our patients. We always want to put yourself into the patient's shoe and say, okay, if this was being done to me, would I want this explained to me? And most certainly, yes, you would. So explain to your patient that you're about to change the PICC line of the dressing, what you're going to do, every step. So you want to lay out your aseptic field. You want to make sure that you have everything, that there's already things in your dressing pack, aseptic gloves, and make sure that you change the 2 bungs on the lumens as well, because it's a weekly dressing, and that is all to prevent infections. I can go into the details about changing the dressing in a different video, and let me know in the comments below if that's something you guys would like me to do and actually demonstrate. Next is then the troubleshooting aspect of PICC lines. So a few things can go wrong. One of the biggest things that can go wrong is the PICC line may get blocked. And when this happens, I know the first thing we want to do is just panic. But do not panic. Do not panic. Do not panic, because there are ways to actually unblock it. There's a non-pharmacological way and there's a pharmacological way. So the non-pharmacological way is talk to your patient, explain to them, listen, your PICC line's blocked. We are going to try and unblock it. I just need you to just lift your head up, lift your head down, look to the right, look to the left. You can ask them to take a deep breath, give you a cough, get them to lean forward, because oftentimes they're just leaning back in the bed like this. Get them to lean forward. Another thing is you can get them to go for a walk or stand up or go for a walk if they're able. So oftentimes that has worked. Using your ANTT, look for blood back. If there is blood back, then you know you're good to go. The line's unblocked, the clot is gone. One thing to always remember, never administer anything in the PICC line if there's no blood back, because guess what? You don't know where that is going. Could be going anywhere. So if there's no blood back, you need to establish blood back, and until then, do not administer anything. Now, if you've tried that and you've tried that a few times and nothing is working, it's not budging, that clot is still there in the line, it just won't budge. The next option is administering a medication called Torlock. Now, this is all determined by your organization's policy, guidelines, and procedure. But if Torlock is part of your guidelines on unblocking a PICC line, then it's very straightforward. It's 2-person check. A nurse or a doctor can administer it. Basically, you're administering 2 mils into the catheter. It's not going all the way in. It's just staying in the catheter. Clamp it. You want to put a label, that do not use label on it, for about 30 to 60 minutes, because in that time it's dissolving that clot. Come back and you should get blood back, and it works like wonders. Sometimes a doctor would order a chest x-ray just to determine the position of the PICC line. That is the care and management of a PICC line. I hope this video has been educational. It has giving you some advice on how to manage a PICC line, and hopefully you won't be so afraid to go near a PICC line, because now you know the benefits of it and how it actually improves patient care and treatment. So if you've liked this video and you want to see more videos like this, please hit the subscribe button and the bell notification so that you may be notified every time I do videos like this. Until next time, stay safe, stay blessed. Bye.